So I'm Eric Ham with the company CPR Now, and today we're going to be going through the American Heart Association First Aid course, which covers several different emergency situations that you may most likely come across if there is an emergency. So first thing a lot of people ask about is, are they protected legally if they try to provide care for somebody and then that person turns around and tries to sue them? So do you know what the name of the law is in the United States that protects you? Okay, so the correct answer is the Good Samaritan law. Now, wrong answer I heard one time, somebody said, is it Murphy's Law? And that's not what we want to get into. So no, that's not it. So it is the Good Samaritan law. And basically the important thing with that is if you're providing first aid for somebody and they are awake and conscious, in order to be covered by that, you do need to obtain consent. So you would need to tell them your name and ask them permission to help them. So I would say, my name is Eric, I'm trained in first aid, I see your arm is bleeding, can I help you? And then that person would have to give you positive indication, say yes, that you can help them. Now, if it's a child, if their parents are around, you would obtain consent by asking their parents. But if their parents are not there, then it's called implied consent that you could help that child if it was an emergency. Okay, and the next thing we need to be aware of in any type of emergency situation is safety. Okay, so protecting ourselves, especially if that person may have any type of bloodborne pathogen. Okay, so the best way we can do that is you would always want to make sure that you would put gloves on, because that's going to be a barrier between you and any kind of blood that they have. Some other options that would be available. A lot of people forget that things can get in through your eyes into your bloodstream. So another thing you could do to protect yourself would be to wear some type of safety goggles or glasses to protect anything from splashing in. And then a lot of different medical facilities you go to, of course, they have like a head net that you can put on, apron that you can put on as well so things don't get on you. And then, of course, if you're ever doing CPR with a person, you would want to make sure to put a mask over their mouth so that your breath goes into them, but nothing that they have can go into you. Okay, so one of the skills that we're going to go over is how to remove a pair of gloves that's been contaminated. So if there was blood or you had been touching somebody with a pair of gloves, it's best to kind of conceptualize there's an outside part of the glove which has touched the contaminant and the inside part which has touched your skin, which is clean. So first thing you'd want to do is that outside part of the glove always touches the outside. So you could kind of pull the fingertips off a bit first. Okay, and then you kind of ball up, pull the glove all the way off, and here's the key part. You can reach underneath inside, but you don't want to pinch your thumb down or else you've just contaminated your thumb with some blood. So you actually want to get underneath, roll it inside out, and once it's inside out, can you touch it? You can, so you would pull that off, and then you would want to make sure to put that into some type of sharps container or some type of medical waste container. Okay, so it's important to know in our society what are the three main bloodborne pathogens that you may come across. So what those are going to be is HIV, hepatitis B, and hepatitis C. Okay, and the most common way that those can be transmitted is if somebody who had been poked with a needle or used a needle, and then somebody else also gets poked with that needle is where some of that transference can take place. Okay, so next we're going to go through some of the most common different types of emergencies. So we're going to talk about what if somebody had an asthma attack or some kind of breathing emergency and you needed to help that person use an inhaler. So key thing when helping somebody with an inhaler, if they need help, like if it's a young person or something, you would want to make sure that you shake that up, remove the cap off the mouthpiece, and when you put that in the person's mouth, you make sure they tilt their head back, and when you squeeze the cannula, you have them take a deep breath. and you have them hold that in their lungs for 10 seconds or even longer if they're able to, because the longer that medication is in their lungs, the more time it's going to have to open up their bronchioles. Okay, so that's an emergency if you have to use an inhaler. The next thing we're going to talk about is if somebody has an allergic reaction, whether that's to a bee sting or some type of food allergy to peanuts or something like that. So do you know what it's called when a person's throat starts to swell up and they start to not be able to breathe? Okay, so it's a type of shock and it's called anaphylactic shock. Okay, so the question is, what's the best thing we can do to reverse anaphylactic shock or to combat that? And the answer is we would want to use an EpiPen. And of course, first we want to call 911 to make sure that they're on their way. Okay, and anytime you use an EpiPen, it's important. So if I was holding that pen, you wrap your thumb around the middle, not around the side. And the reason is some people hold those backwards, and when they go to inject themselves in the thigh, they actually end up injecting their own selves through their finger if they've got the pen backwards. So if you hold your thumb around the middle, that's going to be the best way you could prevent if you did that accident. Okay, so I'm going to actually show you on my thigh where you'd want to do that, how you'd want to do that. So you go right through the pants, thumb around the middle. You would jab into the thigh, hold it there for 10 seconds. And then when you pull it out, what are you supposed to do at the site of the injection? You're going to massage circles to help get that epinephrine to effuse into the person's body. If it's been 5 to 10 minutes and their reaction has not reduced, you would use a second EpiPen on the other thigh. Again, so where does your thumb go? Right around the middle. You would jab it in, hold it in for how long? 10 seconds. And then when you pull it out, you would massage circles right there. Okay, so usually that EpiPen is going to significantly reduce that anaphylactic shock. Either way, you do still need to get that person to the hospital to make sure that everything is taken care of. The next type of emergency situation we're going to talk about is if you suspect that a person could be having a heart attack. Now, some of the most common symptoms is if the person starts having pain in their chest, but it could also be pain in their arm, in their neck, or their jawline. And the key thing is it's a persisting pain, and they're not quite sure. They know something's wrong. They're not sure what it is. For women, a common symptom is indigestion. So it's pretty common too that people will deny that they're having a heart attack. So you need to be prepared for that. So key thing, if you suspect they are having one, first thing, call 911 to get the ambulance along the way. Then there's something very specific that you're supposed to have that person chew up. So do you know what that is? It's actually an aspirin, because a heart attack is where a vein or an artery somewhere has a blockage in it. And when a person chews up an aspirin, it's going to have an immediate thinning effect on their blood. So hopefully that blood could actually become thinner and go around where that blockage is. Okay, then of course, remain with that person, keep them calm and comfortable. And if they go unconscious, be prepared to do CPR. And if an AED is available, you would want to make sure that you've got that. Right? The next thing we're going to talk about is if a person has diabetes, which affects the level of sugar that's in a person's blood. So it can be too high or too low. So primarily what we're going to talk about is if you suspect that somebody has low blood sugar, what's the best thing that you could do to help them? And common symptoms are they might become very drowsy, they may become lethargic, they may become very moody or very grumpy, almost have an entire personality change. So what's the best thing we could do to help that person? And the answer is we want to give them something that has sugar in it. So it can literally be a sugar packet. Some people with diabetes actually carry glucose. It's like a glucose package that they can do, squirt in their mouth, and it brings the sugar up. You could also do like fruit juice. I've heard a lot of people with diabetes say peanut butter is good because it brings up the sugar and sustains it. You could give a person a pop or a soda, but what kind can it not be? Okay, so it can't be a Diet Coke, or it can't be any Diet anything, or a Coke Zero, something that has a sugar replacement or an artificial sweetener in it. It actually needs to have the sugar in it in order to bring their blood sugar up. Okay, the next thing we're going to talk about is if you suspect that a person is having a stroke. Now, they do have an acronym, which is a 4-letter word, where each letter of that word is a test that you're going to do for a stroke. So the letters you want to remember for a stroke is for the word fast, F-A-S-T. So F, you're going to want to test, do the face test. So you'll ask the person, can they smile? If one side is up and the other side is drooping, then you would know that's a positive indicator that they're having a stroke. A stands for the arm test. So you're going to ask the person, can they lift up both of their arms? If they can raise one arm but not the other one, positive indicator they could be having a stroke. S stands for speech. So if the person has slurred speech, or if they're not able to talk at all, or if they're saying sentences with words that make absolutely no sense, then you know they could be having a stroke. And then finally, T stands for time. You want to record when was the last time that either you saw or anybody saw that person and they were totally normal. So if you think they're having a stroke, it's time to call 911. And you want to be able to let them know, has that occurred within the past hour or 2 hours? Because there is a small window of time where if you get that person to the hospital, they can administer drugs to that person, which can almost entirely alleviate stroke symptoms. Okay. The next thing that we're going to talk about is if a person begins having a seizure, and we're talking about a grand mal seizure, so they fall out on the floor, they're shaking, they're convulsing. So key thing, making sure the scene is safe. You would want to move away any furniture so that they don't injure themselves on it. If they've fallen out on a hard floor or concrete or something like that, you would quickly want to put, whether it's a pillow or a backpack or a hoodie, something underneath their head to protect their head. But you do not want to remain close to them, holding them, because you could get punched or kicked, inadvertently as their body is seizing. So, of course, as you've called 911, you're monitoring them. Once they stop seizing, it's very important. You would want to go up to them and check, do they have a pulse? Are they breathing? And if they do still have a heart rate and they are still breathing, you would want to make sure not to leave that person lying flat on their back. Because when they've had a seizure, it's almost like they've just sprinted for a mile. Their body's pH levels are off. They could be foaming at the mouth, and there's a high incidence that they could throw up. So you wouldn't want to leave them lying flat on their back. You would want to roll one arm up, bend the opposite knee up, and then roll that person onto their side in the recovery position so that their head and neck is in a gravity-assisted position to where if they threw up, it would go out of their mouth instead of back down their throat where they could choke. Okay, and then you would want to continue checking for a pulse. The next scenario we're going to talk about is if somebody has cut themselves and they're bleeding and you need to help them to stop the bleeding. If it's very severe, of course, call 911. You would want to make sure that you put your gloves on. Of course, with the American Heart Association or with the Good Samaritan law, what would we need to do before we could help that person? Obtain consent. So my name's Eric. I'm trained with first aid. Can I help you? And even as you're putting your gloves on, you could hand them, a piece of gauze for them to hold on to their arm to apply pressure to help stop that bleeding. And then most first aid kits will have like a gauze roll. So one of the things you can do on that person's arm is you would start wrapping that gauze roll around and around, of course, with having gloves on. And there's a technique where you would leave a long strand hanging down, And so you would actually pinch the bottom of that strand in the middle, come up on both sides of their arms, and then you could actually tie and sort of cinch down over where that wound is to apply some added pressure to decrease the bleeding. Now, in a last case or last ditch scenario, if you're afraid that the person could actually bleed to death, what's it called when you tie an item in order to try to stop the blood flow? Okay, so it's a tourniquet, and we wouldn't willy-nilly do this like a kid, wrecked his bike or something. This is if you're afraid the person is going to bleed to death. So what you would want to do is take, they have some different types of elastic type materials. If you didn't have this, you could use a belt or you could use a shoelace, but wherever the injury is, you want to move to the next joint above it towards the heart. And then you're going to wrap that item as tight as you can and tie it off in order to stop the bleeding to where that wound is. Okay, and then once you tie a tourniquet on, you will leave it on and you'll make sure until it's like they're at the hospital or a medical professional would be the one to remove that when it's time. Okay. Next, we're going to talk about if somebody has a bloody nose, what should you do? So obviously a bloody nose isn't reason to have to call 911 unless for some reason if the bleeding can't stop and it's been 15 minutes. So you would want to have that person pinch their nostrils. Now, do you have them tilt their head back or tilt their head forward? Okay, so what they recommend now is you tilt the head forward while they're pinching the nostrils, and you would continue to do that until the bloody nose had stopped. Next situation we're going to talk about is if a person would get a tooth knocked out, what's the best way to go about that situation? So again, first thing, you could get like a piece of gauze, have them fold that up and kind of push that up into where the tooth was knocked out, because that's going to help stop the bleeding. Then with gloves on your hands, you would want to pick that tooth up by the crown. That's the part, when you smile, you can see. So you don't want to touch the root, because that has microscopic adhesive molecules on it that if you get that with that person to the dentist very quickly, they can actually get that tooth back up there and it will adhere again over time. So what is the best solution that they recommend you should put the tooth in for that person to take with them to the dentist? Okay, so the correct answer is milk, because that's going to help preserve those molecules. And also they have another item if you don't have milk. So it's actually saliva. And for some reason that helps preserve the teeth. And it doesn't specify, I assume it's their saliva, but it doesn't say whose saliva, but that's supposed to help preserve that tooth on the way. Okay, next emergency we're going to talk about is if a person is impaled. So whether it was with a knife or if it was with a screwdriver or something. So do you leave the item in or would you take it out? And the correct answer is you're going to leave it in. You could do that gauze wrap around it to help secure it, to keep it from bleeding. And you would want to make sure they're at the hospital, because once they remove it, if that's nicked an artery or a vein, they'll be able to suture that or cauterize it in order to get the bleeding to stop. Okay. Next thing we're going to talk about is an amputation. So what if somebody's using a saw, accidentally cuts off a finger? So first thing, of course, call 911. And you would want to make sure you stopped the bleeding. So, you could wrap up, if it was a finger, the stubby area, or have them hold right there to stop the bleeding. You would want to pick up the appendage that has any dirt on it. You'd very quickly want to rinse that off with water. And very important, you would want to put that appendage in a dry Ziploc bag, its own bag. Then you would want to put that in another bag that has ice in it. So that's going to help preserve it. And you wouldn't want to put the finger or whatever it was into the bag directly with the ice, because as that ice melts, that tissue could become waterlogged and it could damage it permanently. Next item we're going to talk about is if you suspect that somebody has a head, neck, or spinal cord injury. Okay, now statistically, this is most often going to happen if a person fell off a ladder, out of a tree, or off a roof. Motorcycle accidents, diving into a shallow pool, even car accidents. So if you're ever in one of those types of emergencies, you want to know, okay, there could be a higher percent chance that somebody could have a head, neck, or spinal cord injury. A lot of times looking at the person, if their head and neck is in a very abnormal or unusual situation or position, then that would be your number one indicator. So a majority of the time, we're not going to want to move that person because that could cause further injury to their spine. But there's two scenarios where it would be appropriate to move that person, even though there's the risk of further injury. Okay, so can you think of what either one of those might be? Okay, so the first one we're going to talk about is if the scene is unsafe. So if they're floating in the pool, obviously you've got to get them out of the pool so that they don't drown. Or if they're in the middle of the highway, with a car accident or something, or a motorcycle accident, or if a house is on fire, you've got to get them out. So even though that could cause further damage, we do need to get them to where the scene is safe. Okay? And then the second scenario would be if the person was lying face down and we determined that they did not have a pulse, we would need to flip them onto their back in order to begin doing CPR for that person. Okay. The next scenario we're going to talk about is if a person has a broken bone or if they sprain a joint. Okay, so it's very important to know when it would be appropriate, like to put a splint onto a person. Okay, so if a person, say they're coming out of Walmart, they miss a step, they fall and dislocate their shoulder, well, we could use a triangle bandage to tie it behind their back or to tie it behind their neck to hold it in place, or use some kind of hoodie or long sleeve shirt. But in that scenario, we wouldn't need to because we could keep them in that spot until the ambulance shows up. So that would be a situation where you would not do a splint. So can you think, when would it be appropriate to do a splint? So how about if a person were hiking, they're outside of cell phone reception, and the person falls and dislocates they fall, hit their arm, dislocate their shoulder. Well, if we've got to hike them out for a mile or two, then it would be appropriate to do that sling for them because we've got to try to stabilize it as we move that person. Okay, so for a broken bone, there's two basic types of splints that we could do for a person. Okay, so if you imagine a person broke their finger. So the first is called a rigid splint or an immobilization splint. And that would be like if you took a popsicle stick, a pen or pencil, and taped their finger to it to stabilize it. Okay, so that's one type. The next type is called an anatomical splint. So what would that example be for a broken finger? Well, this is where you're going to use another part of their anatomy to stabilize. So you could take another finger and tape it to that finger in order to stabilize that joint. Okay, next situation we're going to talk about is if somebody has been stung by a bee and the stinger is left inside of that person. So, sometimes you can actually see that stinger there. What's the best way, or how does American Heart Association recommend that you remove that stinger? So they don't recommend that you use a pair of tweezers because a bee's stinger is hollow, especially if that person has any kind of bee sting allergy. If you squeeze with a pair of tweezers, that could squeeze more of that venom into the person. So the best thing that American Heart Association recommends is that you would take like a credit card or some type of ID badge, and you would want to run that and scrape it straight across where that bee stinger is, and to help get that stinger out of the person. Okay, the next scenario we're going to talk about is if a person has a tick embedded on them. Now, for a tick, you are going to want to use a pair of tweezers. You would want to get as close to the head as possible. Never twist. You want to pull it straight out. And then the question is, what's the best thing to do with the tick after you remove it? Now, most people feel vindictive. They want to burn it or, flush it down the toilet. But actually what they recommend you do is placing that in a Ziploc bag, putting it in the freezer, which, will kill it. But that will help preserve the tick, because some tick-borne illnesses, symptoms don't appear until up to 30 days after you've removed that tick. So it would be good for the doctor to be able to identify what type of tick it is, because some ticks can carry Rocky Mountain spotted fever, when then other types of ticks carry Lyme's disease or something. So you do actually want to hang on to that for that situation. Okay. Next, we're going to talk about heat-related emergencies. So if somebody's really been pushing themselves and exercising out in the heat, or really working, and they get to the point where they are almost passed out, this is going to be known as heat exhaustion. And this point isn't where they just need to sit down and cool off for a few minutes and go back to work. They've actually depleted their body from electrolytes, even at the ATP cellular level. So you need to get this person out of the heat, remove as much clothing as possible, call 911 to make sure that they're on their way, and then you want to start doing your best to try to cool that person down. So if you have any type of water misting spray, cool cloths on their armpits, on their neck, on their forehead, because you're trying to bring their blood temperature down. You could also, as long as they're awake and alert, give them cool water to drink, or Gatorade, or some type of drink that has sugar and electrolytes in it, in order to try to help replenish that person. Now, what's the next step past heat exhaustion? And that's actually a heat stroke. And this is like getting into very much an emergency situation, because once they've hit that level, which medically is when their body's temperature has gone over 105 degrees, different parts of their body are starting to shut down. So actually sweating can start stopping, different parts of the brain function decrease. So in this situation, you want to try to get that person into water up to their neck as fast as possible to bring their body temperature down. So if you were able to carry or lift them, or have somebody help you, get them into a bathtub or a shower, or if you're outside and there's a swimming pool or a pond or a creek, you could do that. Now, what if you weren't able to move that person? Well, if you have a garden hose that you could extend out to them, that could be something that'd be very effective. But you need to remember, if it's been a hot day and that hose has been sitting out in the sun, what would you need to do first? Okay. So run that scalding water out of the hose first, which you could remove the nozzle, which is going to allow that water to flow out. And once that cool water starts, you could get that person's head, not their face, but then their body as well, to try to bring down their body temperature. Okay, now on the other end of the spectrum, talking about cold-related emergencies, we're going to have hypothermia, and we'll also have frostbite. So first we'll talk about frostbite, which usually affects the tips of the extremities, because that's what's most exposed to the cold. So you want to get that person out of the cold, remove any wet clothing, of course call 911 if it's severe frostbite, and you want to use just the room temperature air, or like a heat source, so a heater. If you're able to get them into a car, you could use the heater from the car to kind of slowly thaw out that tissue, because frostbite, it literally becomes frozen, the skin does, wherever that frostbite occurs. Okay, so you would never want to do friction, because that could damage that tissue. That becomes more delicate and fragile when it's frozen. Now with hypothermia, so medically, if the body's core temperature drops below 95 degrees, that's going to be the indicator this person has hypothermia. So again, get them out of the cold, remove any wet clothing. You want to cover them with towels, blankets, newspapers, anything that you have to try to help trap in their body heat. Cover their head, but not their face. And then be sure to be checking their pulse to see if they're going to need CPR or not. And sometimes with somebody's hypothermia, their body almost has a bluish color to it. They can appear to actually be dead because of that reason, and they may have a very faint pulse. So when in doubt, if you can't tell, be prepared to do CPR for that person to help save their life. Okay, now the last scenario we're going to talk about is a poisoning emergency. So there's basically 3 different ways that a person could get poisoned. They could either breathe in a gas fume, an invisible gas. They could ingest some type of liquid and it gets in their system. Or there's certain type of powders that could get onto a person's skin that could seep in. So key thing, no matter what type of poisoning emergency it could be, number 1 priority is safety. So we want to make sure we're not just rushing into an area where now we could become injured and there's nobody to help in that situation. So key thing, make sure the scene is safe. If it's an enclosed area and you see there's more than one person who appears to be unconscious and it's not obvious why, everything in the room looks totally normal, then you want to suspect there could be a gas leak. So you wouldn't barge in, you wouldn't open the door unless you had some type of gas mask or hazmat suit. You would want to call 911, of course, to let them know, and you would look for any spilled or leaking containers. If a person has ingested any type of poison or pills or anything like that, you would want to make sure to call 911 and also call poison control, which they do make that phone number easy. Now you could always Google, real quick, just tell it to call poison control. Or if you want to remember the number, it's 1-800-222-1222. And they can let you know if there's anything you can do to help offset whatever poison that person has had. If a person gets a poison splashed on them, so if it's like battery acid or some type of base solution, you would want to try to get them to a shower and douse it with as much water to get that rinsed off the person as fast as possible so it doesn't react any longer than necessary on their skin. Now, if a person got poison splashed into one of their eyes, so say it was into their right eye, well, if you're at a factory or an industrial place that has a eye wash station, that's going to be the most effective, where you either push a foot pump or a pedal and it would flush their eyes out. But if you're just out and about and you've got a water bottle, that could be effective to help flush that eye out, but it's important to know which shoulder should you have that person tilt their head. Now, if it's their right eye, you would want to make sure to tilt towards the right side so that when you pour that water from the bridge of their nose, it washes that poison out. So what would happen if they went to the other shoulder? Well, when you do that water bottle, it could go from one eye into the other eye, and then that could cause them to have it in both of their eyes instead of just one. Okay, well, thank you so much for walking through these different types of emergency. So I feel confident if you ever need to act in an emergency situation, you'll feel bold and you'll feel brave enough to step in there and help somebody out. So again, my name is Eric, and I've enjoyed doing this first aid portion with you by the American Heart Association.